I'm Mr. Prabakar. I'm from Department of Medical Laboratory Technology and Microbiology. Today I'll be talking on the chapter immunity. We also will be talking about the references and types, factors predisposing to mechanism, and types and mechanisms of acquired immunity. Moving on to the main topic, we initiate the class with the definitions. The term immunity is derived from a Latin word immunitas, which defines or means that any resistance that is offered against a host or an external microorganisms. That's nothing but the ability of the body to protect it against any external substances, living or non-living, is considered as immunity. If you look at the immunity, it is broadly classified into two types. We have innate immunity and acquired immunity. Innate immunity can be subdivided into individual, species, racial. Acquired immunity will be subdivided into active and passive. Both active and passive immunity can be acquired through natural as well as artificial medium or mode. Now let us look into innate immunity. Innate immunity is nothing but the inborn resistance against infection that an individual possesses right from the time of birth. This is majorly due to the genetic makeup of the individual. We can subdivide this innate immunity into species immunity, which is nothing but an immunity exhibited by all the members of a same species. For example, in comparison to frogs and toads, frogs are more resistant to Bacillus anthracis while toads are more susceptible to Bacillus anthracis. Next, moving on to the racial immunity. Immunity that is exhibited by a specific race within a species is known as racial immunity. For example, African Americans are more susceptible to tuberculosis than American whites. Moving on, within the race we have individuals. Each individual have their own immunity, hence it is categorized into a separate section known as individual immunity. Individuals of one particular race experience lesser severe infections than individuals of same race. For example, let us talk about the homozygous and heterozygous twins. Homozygous twins show similar degree of resistance in comparison to heterozygous twins. Now let us look into the factors which normally influence the innate immunity. There are three main factors that have influence on the innate immunity. We have the age, hormone and nutrition. Age. As the age increases, the immune level and immune response also increases to one particular point where the immune system will also degrade as the age increases. For example, the fetus will be protected by the mother's antibodies when it is within the uterus, but there are some conditions or cases where organisms like rubella virus and cytomegalovirus do invade this and cause infection into the fetus. In old age, as the age increases, the immune cells and the immune organs will also increase, but at one particular point of time, the immune organs will start reducing in function and size, that in turn will reduce the immune response too. Hormonal influence, I have taken the example of diabetes mellitus. Now diabetes mellitus is nothing but hypoglycemic and hyperglycemic conditions. Hyperglycemic condition is considered as diabetes mellitus, where some organisms like staphylococcus infection and streptococcal infection are more easy to be acquired by these individuals who have these hormonal disorders. Another example of hormonal influence in innate immunity is that pregnant women tend to produce steroids during the time of pregnancy. So, for a short temporary period, they are more susceptible to infection due to the high level of steroids that are produced during the time of pregnancy. Next, let us look into the nutrition. Nutrition also plays an important role in innate immunity. All the humoral and cell-mediated immunity that we possess in us is derived from the nutrition that we take in. Example, if there is a protein calorie malnutrition seen in individual, the individual's neutrophils activity will be reduced, interferon response will be decreased, complement 3 and factor B also will be decreased in such condition. Hence, we can understand how the nutrition plays an important role in the day-to-day life of the innate immunity. There are also other examples like deficiency of vitamin A, vitamin C and folic acid do make this individual more susceptible to many of the microbial pathogenic infections. Now, these three factors influence the innate mechanism. Now, let us look at the factors or mechanism by which the innate immunity actually functions. You can categorize them into 7 major mechanisms of innate immunity. We have the first, mechanical barrier or the epithelial surface. Second, we have the antibacterial substances and blood tissues, microbial antagonism, cellular factors in innate immunity, inflammation, fever and acute phase proteins. I will be walking through individually each of these mechanisms. We will begin with mechanical barrier first. Before we go into the mechanical barrier, I would like to showcase in this particular picture that the first line of defense mechanism is done by the innate immunity. We have examples like saliva, which has an antibacterial enzymes, then we have tears which have antibacterial enzymes, skin which prevents the major entry of microorganisms, mucous linings in some of the genitointestinal tracts and genitourinary tracts. All these things will provide some kind of innate immunity mechanisms. Let us look at the mechanical barrier. Skin functions as a major barrier for entry of pathogen. It has keratinized epithelial surfaces which do not allow all the bacteria and microorganisms to enter into the body. It also produces sweat and oil, which are secretions at a lower pH will be toxic to the microbes physically. Then in some of the gastrointestinal tracts, respiratory tracts and eyes, ears, etc., we have mucous linings which produce mucus, which in turn helps in removal of this external pathogens if they come into the body beyond the mechanical barrier. Some of the examples have been put up here. We have the gastrointestinal tract where we have saliva in the mouth which is rich in lysozymes, an enzyme, and also we have gastric juice. Both of them are potentially harmful for the microorganisms. Moving on to the respiratory tract, again here we have the mucous linings and also we have hairs and cilia which filters out most of the microbes and dust from the upper respiratory tract. Moving on to the reproductive and urinary tract, urine washes off microbes from the urethra. Acidic pH of vagina and antimicrobial activity of the semen also is very harmful for the pathogen, which provides a type of innate immunity in our body. Secondly, we come to the antibacterial substances that are present in our blood as well as in the tissue. For example, we have lot of antibacterial substances. One such example is the complement. Complement is a set of proteins which have bactericidal activity and these function in the blood and tissues. We do have some other special proteins like interferons which are produced by the WBC in blood which interfere with the viral replications, and also we have some of the other antimicrobial substances produced in the blood and tissues like lysozymes, beta-lysine and leukocidin. Next we come to microbial antagonism. Microbial antagonism is nothing but a concept where an existing microorganism does not allow the growth of a new organisms. In comparison to human beings, the existence of the normal flora, normal microorganisms does not allow the external pathogenic microorganisms to come and settle on the surface and cause infections. This is known as microbial antagonism. For example, the skin and mucous surface have resident bacterial flora which prevents colonization of the pathogenic microorganisms. Fourthly, we have the cellular factors in innate immunity. There are certain cells in our body whose major function is to provide protection to us when there is an invading pathogen. Phagocytic cells are nothing but cells which engulf microorganisms and destroy them on a day-to-day basis. Next, we have fibrinogen, a protein that gets converted into fibrin which majorly helps in clotting mechanism. When talking in microbiological concept, this fibrin does not allow the spread of microorganism from the site of infections. Then we come to the natural killer cells, which is a non-specific defense mechanism that is produced against any viral infections or tumors in our body. Phagocytes can be of two types. We have the mononuclear phagocytes and we have the polymorphonuclear leukocytes. Mononuclear phagocytes in the tissues are called as macrophages, whereas if they are present in the blood, they are called as monocyte. Polymorphonuclear leukocytes are called as macrophages. These cells together will involve in phagocytosis, a process by which most of the pathogenic organisms are destroyed in our body. Fifth, we have inflammation. Inflammation is nothing but a defense mechanism produced by the body. It is a response of vascular connective tissue towards any injury. For example, if you see in the picture, a slight thorn prick can induce harmful things into the tissues. The underlying endothelial cells will react to this particular injury. Once injury happens, you have the 4 stages of inflammation: pain, warmth, swelling and redness together will attract more and more neutrophils and other immune cells to the site of injury, thereby they can destroy the invading pathogen. So, when a tissue gets injured, the blood vessels will constrict. This will restrict the movement of pathogens into the blood system. After a certain period of time, the blood cells or the blood vessels will dilate, known as vasodilation, which will increase the blood flow towards the site of injury. This increase is majorly for all the immune cells to come to the site of injury. Once this happens, the blood vessels will slowly start allowing other cells to enter through them. Normally these are only permeable to salts and water, but at the time of injury they become more permeable to most of the immune cells. Once this is done, we have the clotting factor fibrinogen converting to fibrin, restricting the movement of pathogen. Ultimately, all the immune cells that are coming to this particular point will start destroying the pathogen too. 6, we have fever. Fever is nothing but the body temperature increase from the normal temperature of the body. This is majorly focused to destroy the organisms that are invading our body. Normally the microorganisms cannot withstand higher temperatures, hence the body's mechanism makes the body to increase the temperature, internal temperature, thereby destroying most of the pathogenic. Fevers also stimulate production of interferons which help against a viral infection. 7th, we have certain types of protein. These are non-specific proteins which are get increased or decreased in response to inflammation or infections. We have C-reactive protein and mannose binding protein. These are together called as positive acute phase proteins, that is if they increase, or negative acute phase proteins, that is if they decrease, and majorly influenced by the inflammation process. To summarize the whole concept of mechanisms of innate immunity, first we have the physical barrier which tries to avoid any invading pathogens. By chance, if these pathogens can come across the physical barrier, then we have the mucosal barrier which produces mucus and other secretions which in turn invade the pathogen and destroy the pathogen. By chance the pathogen crosses this barrier, it enters into the body, comes in contact with the immune cells and blood tissues which are getting activated in response to the invading pathogen, thereby attracting more and more immune cells to the site where the pathogen resides and destroys the pathogen. Next, we move on to the acquired immunity. Acquired immunity, the name itself suggests that this is an immunity that we acquire throughout the course of life, right from the time of birth till the time of death. Broadly, you can subclassify this acquired immunity into two types. We have active immunity and passive immunity. I focused here on the subsets of acquired immunity. We have active immunity and passive immunity. Active immunity is categorized, subdivided into natural active immunity and artificial active immunity, whereas passive immunity is again further subdivided into natural and artificial. Let us look at the individual concepts of this. Active immunity is nothing but a resistance that is developed in response to an infection by an individual through an antigenic stimulus. You can subclassify them into two types. Natural active immunity, which is nothing but the normal way of getting an infection, that is nothing but the resistance which develops towards a clinical or subclinical infection. For example, immunity that is developed after getting an infection of chickenpox. Second, we have the artificial active immunity, which is nothing but a resistance induced by immunogen, usually through vaccination, example oral polio vaccine. Now, mechanism of this active immunity involves both humoral and cell mediated immunity. Humoral mediated immunity is nothing but the immunity that is produced against an infection with the help of antibodies, which normally circulate the blood and lymphatic system, majorly produced by the B lymphocytes, whereas cell mediated immunity is nothing but the primary function of the activated T cells, macrophages, and release of cytokines against an antigen. I have placed the concept here to summarize both cell mediated as well as humoral mediated immune response. If you look at the picture, you can see there is a first exposure of antigen which is engulfed by the dendritic cells, thereby activating the helper T cells. Now, helper T cell give rise to memory T cells, and this memory T cell will hold the memory of this particular antigen for the rest of the life. Now, in the left hand side you can see that the first exposure after the antigen comes in contact with helper T cell, it also activates B lymphocyte, which again gives rise to two subsets, plasma cells majorly producing antibodies and memory B cells again producing a memory of the antigen. Simultaneously, if there is an intact antigen, it could also activate the B lymphocyte together along with the helper T cells. On the right hand side, if you see, there is cytotoxic T cells which get activated by again the helper T cell, which again divides into active cytotoxic T cell and memory cytotoxic T cell. Active cytotoxic T cell helps in destroying the infections, majorly viral infections and cancerous conditions. Now, I have put this all together to indicate that both the humoral immune response, which is done by the B cell, and cell-mediated immune response done by the T cells work hand in hand, and it is not like a step-by-step procedure where they go one after the other, but a simultaneous procedure where they get activated with differences of seconds in their activation, thereby providing immunity or protection against any pathogen. Passive immunity is nothing but also called as a borrowed immunity from another source. We can subclassify this into natural passive immunity, which is nothing but an immunity provided by natural transfer of antibodies, whereas artificial passive immunity is nothing but an immunity induced through the transfer of anti-seras. I have summarized the mechanism of acquired immunity. Now, you can see there is in the first column, you can see natural passive immunity is nothing but ready-made antibodies is given from the mother to child to protect the child from any invading pathogen, whereas artificial acquired passive immunity is nothing but ready-made antibodies are given through the patient directly, which are produced in the laboratories. Natural active immunity on the other hand is nothing but your normal illness or subclinical clinical illness through which you get the immunity for any infections. On the other hand, artificial active immunity is nothing but vaccination for an existing infection will give you immunity. So, this will act like that of illness or like that of clinical or subclinical infection, but it will prepare us for the actual infection. The similarities between active and passive: both active and passive are two types of adaptive immunity, and both active and passive deal with antibodies, and they can be acquired either naturally or artificially. Here I would like to focus on the antibodies. In active immunity, antibodies are produced by a person's own cells, whereas in passive immunity, antibodies are produced from outside the body and given to the individuals. Pathogen has a direct contact in the active immunity, whereas in passive immunity, the pathogen has no direct contact with the body. The response time in active immunity is highly rapid, whereas in passive, it is rapid but not as that much of active. The rapid response indicates or helps us to produce the immunity for a lifelong period, whereas the passive immunity, the immunity produced is for a short duration of time. Immunological memory is great in case of active immunity, whereas it is least in case of passive immunity. Side effects are less in comparison to active immunity. Passive immunity has more side effects as the antisera can be produced from other sources too. Immunodeficient hosts, active immunity does not work that well. In comparison, passive immunity is highly beneficial for immunodeficient hosts. To summarize, immunity is defined as a resistance exhibited by the host against foreign antigen including microorganism. Immunity may be innate or acquired. Acquired immunity is of two types, active and passive. Active and passive can be subdivided into two types, natural and artificial. Artificial active immunity may be produced by vaccination, whereas artificial passive immunity is through parenteral administration of antibodies. These are the references, and thank you very much.